So, good morning, students. This topic we are going to discuss today is about one more ART or assisted reproductive techniques in the unit of reproductive techniques. Till now, we have discussed about in vitro fertilization or IVF and intracytoplasmic sperm injection or ICSI. So, we have seen that in case of IVF, the eggs are collected from the ovary, and then the eggs and the sperms, the gametes are introduced in the artificial laboratory condition, and they are allowed to either fertilize in a natural way where the sperm locates the eggs and the fusion of the gametes takes place, and then the zygote develops into an embryo, and then the further process takes place. Or if suppose the somehow the sperms are not able to locate the ovum, or some of the sperms are not able to penetrate the cytoplasm or penetrate the ovum to fertilize it. Technique which is called as the intracytoplasmic sperm injection is used, where a small micropipette or an injection is used to penetrate the egg envelope, and a sperm is directly injected in the egg cytoplasm. These are the techniques which are helpful in vitro fertilization or IVF techniques or ART. That's one of the ART. Now, one big term here is GIFT or gamete intrafallopian transfer, and ZIFT or zygote intrafallopian transfer, and IUT, that is intrauterine transfer of embryo. So we are going to discuss about three different topics today. So first of all, what is GIFT or gift? Now, in case of IVF, where the egg was collected out and it was allowed to fuse with the sperm either naturally or used with the use of ICSI, some people who suffer from infertility problem, but they do not want this type of artificial fertilization. They want the fertilization to take place in the natural way. In case of natural way, the fertilization takes place over here in the fallopian tube at this site. Over here, the fallopian tube, it is the fallopian tube where the fertilization takes place. From the ovary, the egg is released out, and the egg then reaches to the fallopian tube. Here, the sperms are present, which fertilize the egg, and then the egg converts into the zygote. And when the egg reaches up to here, this is the site of implantation of the embryo, also known as the uterus. Till here, the egg is now 8 cell or 16 cell stage, and then it implants itself in the uterine endometrium. Now, this is the site of fertilization, and many people, those who do not want an artificial type of fertilization in the petri plate or in vitro condition or with the use of ICSI, they go for the gamete intrafallopian transfer. This is a very small and very easy concept to understand. So rest of the thing which we discussed in IVF with the use of hormones to stimulate superovulation, and the use of LH for maturation of the ovum. Everything is same over here. What is there in the IVF? This is actually one of the part of, or you can say, one of the modification of IVF. Instead of allowing the gametes to fuse in the laboratory condition, the gametes are made fuse to in the natural condition in the body of the mother itself. So, with the use of hormones, superovulation is stimulated in the ovary, and more than 3 to 4 ovums are collected from the ovary, just like what happened in IVF. It is collected directly from the ovary, and then the egg and the sperm egg and the sperm, they are directly released out, or they are released out with the help of a small catheter in the fallopian tube over here in the fallopian tube. It is not like the egg and the sperms are fused and then it is released. It is before the fusion, before the fertilization takes place. The eggs, four different eggs and sperm is released over here. So eggs and sperm, they fertilize in a natural way, they fuse in the natural way over here, and then the further procedure takes place. So whichever egg is fertilized, it will convert into zygote, and then the zygote will move here in the uterus, and it will get implanted as an embryo. So this is what happens in case of gamete intrafallopian transfer. A little bit different from IVF. Over here, it is a little bit more surgical. It is more invasive. A small cut is made in the female's body, for injecting these sperms and eggs back in the body. So you can see there's a small use of a syringe to insert those eggs and the sperm back in the fallopian tube. So in case of IVF, we have seen that the once the ovum is taken up, the embryo was inserted in the uterus and not in the fallopian tube. But in case of the uh, gamete intrafallopian transfer, these gametes are released out in the fallopian tube. So instead of going for an artificial in vitro fertilization, the people go for this type of natural way of fertilization. This is the natural way of fertilization. It's only assisted with the help of the techniques. Why we are going for this assisted reproductive techniques or ART? To solve the infertility. So it could be like female infertility, the female eggs are not getting ovulated properly, or it could be like that the male sperms are not major in number, or it could be one more reason that what happens is, suppose the eggs are frozen, suppose they were frozen eggs, so suppose the eggs were if a lady does not want to conceive at a particular time of her age, and but she wants to keep her healthy eggs. So what the techniques do? They cryopreserve the egg. So the eggs are cryopreserved in the liquid nitrogen, and those cryopreserved eggs are then used for in future for development of an embryo. So this cryopreserved egg, and again the lady does not want to go for an artificial fertilization in that case also. So this cryopreserved eggs could be used in future for. So this cryopreserved eggs could be used in future for embryo development. So and sometimes it also happens that the sperms are also, in case of artificial insemination, the sperms are also released out in the fallopian tube directly. So this is one way of assisted reproductive technique or ART, where the gametes are transferred in the fallopian tube. That is called as GIFT or GIFT or gamete intrafallopian transfer. Now we'll move to the next part, that is the zygote intrafallopian transfer or ZIFT, ZIFT, ZIFT. Over here, see, once an egg and a sperm fuse together, what we get is the single cell diploid egg. So this stage of a diploid egg is called as a zygote, a single cell, unicellular first stage of embryonic development. Then the zygote undergoes cleavage to give you two cells, then the two cells undergo cleavage to give you four, 4 to 8, 8 to 16, 32, 64, so and so on, so and so forth. So this stage is called as the zygote, which is the first embryonic stage, which occurs after the fusion of the egg and the sperm. And sometimes what happens that in case of the treatment of the infertility, instead of keeping the embryo back in the uterus, the another method is by going for IVF. One of the modification of IVF, ZIFT was actually developed in 1986. It is in practice in 1986, but it is more invasive, more application of surgical methods. So because we are using a small incision is made, a cut is made in the female's body to insert the zygote, that single cell embryonic stage, back in the fallopian tube. Okay, it is also placed in the fallopian tube. This is what happens in nature, natural condition. The zygote is formed over here, and then it moves to the uterus. By the time it moves to the uterus, it is already undergone cleavage, and from single cell to, it is now more than 64 to 128 cell stage, and then once it reaches to uterus, it implants itself in the uterine endometrium, and the embryonic development takes place. So again, the same thing. People do not want to have the development of the embryo outside in a petri plate. But if suppose somehow the fertilization is not taking place in the fallopian tube, or if suppose they are going for ICS sign, or intracytoplasmic sperm injection technique during the IVF, during the treatment. Then what the zygote is got from ICSI, it is directly placed or released out in the fallopian tube. Now, one more thing over here is whatever methods we are practicing in IVF, like hyperovulation and use of hormones like FSH, LH, and then progesterone, estrogen, those all hormones, those same hormones, the same treatment is used over here also. But the only difference is instead of releasing out the embryo in the uterus, it is like released out in the fallopian tube in the early stage itself, in the zygotic stage itself. So instead of waiting for a week or 4 to 5 days to release out the embryo in the uterus, within a day, the zygote is released out in the fallopian tube. Now, the same thing happens over here also to give more of a guarantee for the patient that the problem of infertility will be solved and the patient will conceive a baby. More than one zygote is released out in the fallopian tube. So either one of them will be successfully implanting itself in the uterine wall. So here also one of the side effect is the multiple pregnancy, what we have seen in case of IVF. So side effects remain same in all the ARTs, multiple pregnancies or sometimes also ectopic pregnancy, where the zygote develops in the outer lining of the uterus instead of the inner endometrium. So this is what happens in case of zygote intrafallopian transfer or ZIFT. Then we'll discuss about one more technique, and as this is how zygote intrafallopian transfer takes place. So one more interesting technique or one more ART, that is called as intrauterine transfer of embryo. Now this is the last step of IVF. So instead of placing the zygote in the fallopian tube, the zygote is allowed to develop into around 64 to 128 cell stage, or to say blastula properly. And then with the help of a catheter, a small syringe, the blastula is released out in the uterus over here in the uterus. Again, the hormonal treatment is given, so most of the hormone like progesterone, estrogen, which prepares the uterine endometrium to accept the embryo, or to accept the embryo and start for the implantation of the embryo, is made, so that when the embryo is released in the uterus, the embryo, when it comes in the endometrium of the uterus is already acceptive or receptive to the embryo, and the implantation will be successful. So this is how the intrauterine transfer of embryo occurs. The major difference between ZIFT and intrauterine transfer of embryo is, first of all, in case of ZIFT, a zygote is transferred, and in case of IUT, a blastula is transferred. In case of ZIFT, it is transferred in the fallopian tube, and in case of IUT, it is placed in the uterus directly. In case of ZIFT, it is more invasive. It requires a small surgery. Small incision is made in the female body. In case of intrauterine transfer, no need of a surgery or no need of a kind of an invasion, or no need of an incision is there. No cut is required. So it is non-invasive in compared to ZIFT. Although the success rate of ZIFT and IUT remains same depending upon the type of the or the quality of the gamete, and as in case of both, we are seeing that more than one embryo is released out, so that at least there should be implantation of one of the embryo to give the patient a guarantee of uh, treatment or guarantee of conceiving a baby. So that was about ZIFT, GIFT, and IUT. So the next topic will be the use of transgenic animal. So these were the ART what we have discussed. We have discussed about IVF, we have discussed about ICSI, and we have discussed about GIFT, ZIFT, and IUT. So if there is any doubt, you can ask me in the classroom. Thank you, students. So here is one more picture. You can see more than one embryo is placed in the uterus with the help of a small catheter.